Welcome to Nurse Table Talk. I'm Kathy.
I'm Julie.
Today we are going to talk about telehealth and what that is and what
Right.
it's for and all this other business. So I
Right.
feel like I was just telling Julie, I feel like the world said COVID-19 and then the next word they said was telehealth.
Right.
And they really didn't explain to anybody
No, everybody's going, well, what is that?
what that is.
And then they would use words interchangeably like virtual care, telehealth, phones,
Telemedicine,
Yeah,
that was
it's
another one.
computers, phones, and it was just all jumbled, and people
Yeah.
didn't really
Confusing.
Yeah, it's very confusing.
And I was confused, I'm a nurse and I'm confused watching
And
the
me
news.
as
So I'm
well.
like, oh boy,
Yeah.
we've got to address this.
Yeah.
So we're going to talk about telehealth today and what it is, who it's for, why
Right.
it's important. Julie
Right.
has an excellent example to start us off with.
Well, telehealth, first of all, is communication between clinicians and their patients, and it can be done over the computer or over the phone. It can be used like FaceTime or Skype if you are familiar with that.
So what happened with you?
And just one other thing too before I forget is it can be used to show diagnostic labs, things, conference calls, care plans. I mean, people are doing the virtual
Yeah.
thing with everything now because
Yeah.
of COVID. So I just wanted to throw that in there. But my story was, so one day I woke up and I had this sore throat and it was the middle of winter and I'm thinking, oh, I better call my doctor, and really do they even want to see me because COVID had just started and that's when I had this sore throat. So I called my healthcare provider, my doctor's office, and they said, are you interested in doing an appointment over your computer? And I said, well, sure. And they said, well, you don't have to leave your own home. And I said,
Yeah.
and it's winter and it's blustery out. And I'm like, oh, perfect. So, and I don't have to really put makeup on, and I can just
do it in your pajamas.
yeah, I mean, I had to look a little decent, but So I said, sure, but I don't know how to do that. So where do we start? And she said, well, I'll tell you what, we're going to set up a time. They're really prompt, and we have an application, a little app you put on your phone, and it took 3 minutes, and they showed me how to do that. And then they said, okay, that's all set. So now we're going to have the call. So sure enough, right on the money, right at the time, the doctor calls and said, hi, are you Julie? And I'm so-and-so. And I said, sure. And he said, okay, turn on your computer. And all of a sudden, poof, there he was. And I'm like, oh my gosh. So he's looking at me, I'm looking at him. Oh, and I did have to think, like, what's in the background of this picture that he sees? Because he's seeing me and anything behind me. And he said, so I want you to stick your tongue out. And I'm like, really? And so, well, first he showed his ID, and then he had me put my driver's license up to the camera, and he says, okay, this is who I am. I know that's you. So now let's get on to business and let's stick out your tongue. And I'm like, really? You can see my tongue? And he's got the flashlight, and and I got my throat going like that over the, and he's got this flashlight. And he says, yeah, that's what it is. You have a sore throat. I said, yeah. He said, so I'm going to prescribe an antibiotic, and you don't have to leave your house, and they'll call you. Well, when you feel better, you can, you want to get the antibiotic at the drugstore, but, I can send a family member to do that or whatever. But it was so awesome. And
So
it was quick.
huge convenience.
Yeah, I didn't have to wait in the lobby or their waiting room with all the germs and get sicker and expose somebody else. It was just... And with COVID, like with all the news and that, so
yeah, I mean, yeah, it's a nice option.
Right. So that was my story.
It's actually almost becoming a mainstream anymore.
Right.
So but there are many different kinds of telehealth.
Right.
And telemedicine and digital medicine and all that, and it can get a little confusing and a little overwhelming, and that's why we want to talk about it today and just kind of like explain pieces and parts of this so that people aren't overwhelmed. Like the minute she said computer, my brain goes to, but what about all of my 80-year-old patients who aren't computer savvy?
And they can use their phone. They can use their phone. And one thing I should say too is a lot of health systems have health portals where you can log into their health portal, and you can do telehealth. My understanding is through that as well.
Yeah.
So you don't maybe need an app.
You
can just call your doctor's office and they can help you set it up.
Yeah, and the doctor's offices are generally pretty wise to the fact that not everybody lives with technology in their home.
Right.
So if you don't have a computer and you don't have a smartphone, that does not take you out of the running for being able to do a telemedicine visit.
Right.
There are different capacities based on what people have access to, so
Right.
that it's not limiting. You just
Right.
have to make maybe an extra phone call to your doctor's office
So they can help
so
you.
that they can help figure out how to do it for you.
Right.
So Julie, who best benefits from these telehealth visits?
Well, people that, there's different conditions. I mean, obviously, if they want to see you, they're going to call you in anyway and say,
Sure.
you know what, after discussing these signs and symptoms, let's have you come in because really I need to check that out. But for mine, you know, I don't want to say minor things. Maybe somebody, you know, hurt their knee or fell, or do I need to come in, or they have a rash, or
Yeah,
you
rashes
know, a
are big,
rash,
yeah.
or something is
Your
going
sore
on.
throat.
Yeah, maybe they, you know, have something going on with their ears, or they have a cough.
Yeah.
And maybe they want to listen to you before you come in, so they may say, okay, let's just cough. I mean, you know, he was able to talk to me one-on-one. It was, you know, they
a really
can,
nice appointment, I'll bet. 'Cause
Yeah,
you're
they
not
can
sharing
have-
space with.
right, but they
bunch of
can
other
handle
people.
with certain things, but other things, at least you start, and that's a starting point, and you say, and if you need to be seen, they will tell you.
I also have talked to a lot of patients recently too, because of COVID,
Right.
that even their follow-up appointments from like either a surgery or an inpatient stay or a condition, I've talked to them and they're even being followed from their providers over the phone for those visits. So it's not even really the emergent or more
Right.
acute things that come up, but it's really the follow-up things like, I started on this medicine 2 weeks ago.
Right.
So how am I feeling now? There's no reason for people to go into the office for that conversation.
Right. And there's a whole slew of things, like maybe you want to know if your urine specimen came back, you had to
Yeah.
go and pee in the cup, and you want to
Yeah.
know, do I have a urine infection? Do I not?
Yeah.
Now they may have you still have to drive and drop
to
a
a
sample
lab,
off
but
or
yeah.
something, but again, they're giving you guidance without you having to sit in the lobby, so that's saving you time.
But also please remember that in the course of these conversations where you're on the phone or on the computer or whatever, this is still your time that you're paying for. So make sure that you get your questions answered.
Write them down.
Make sure that you're feeling like when you hang up that you have a good plan. And these are questions that we would always encourage you to ask,
Right.
because it doesn't make any difference what they tell you if you're not going to write it down, stay organized, or do it after you hang up. It's basically a waste of your time. So
Right.
so keep that in mind too. You always want to be prepared for
Right.
information.
Right.
So we talked about this instead of going to the doctor's
Right,
office.
starting with that.
But one
Yeah.
one thing that we both think is really cool
Right.
is telehealth that is set up by home care agencies. So I think let me put it in a context so that everybody can just kind of like wrap their brain around it,
Sure.
because it's really kind of it's kind of a lot.
Right, they didn't have this back
No,
when
back
I
in
was
the day.
younger. Yeah.
Uh-huh.
So
So what home care agencies do now is, like, let's say you're having a hard time managing your congestive heart failure, which we will talk about. But most patients who are having a rough time with their congestive heart failure are trying to manage a couple of different things. They're watching their weight, their blood pressure, their sodium
their
intake,
fluids.
their fluid.
Right.
And so that's a whole lot to send somebody out the door
Right.
and say, hey, go watch all this stuff, right?
Right. And people
It's
may
not
not
gonna
have a
happen.
blood pressure cuff. They may
Yeah,
not have
they don't
a
have the
scale.
scale, they don't have the equipment, they don't know where, like,
They don't
if
know
you
where to
can
start.
take your blood pressure, where do you send it to? So what home care agencies are, and we're kind of using this computer as a prop, as an example, but what a home care nurse will do is, if a doctor orders you home care, the nurse will actually come and bring a tablet into your house, and it's just like
This
Julie's.
is a little
Yeah,
iPad.
Julie's just has, and they often use iPads, but Julie's just
or
they
any
usually-
type of tablet.
yeah, they'll bring a tablet to your home, and to the tablet is connected, the information for the scale,
They have a scale. Yeah. Blood pressure cuff.
blood pressure cuff, sometimes a pulse ox, the little thing that goes on your finger.
And they're keeping an eye on
Yep.
these.
So that's gonna
these-
start working. So what happens is that I'm the patient right in this scenario, and my doctor says, Kathy, I want you to get on the scale every day at 10 o'clock.
Before you eat or
Yep. And give
and
me
drink
parameters
anything.
like before I take my
Right.
medicine or after I take my medicine, before I have anything to eat, I have to get on the scale, take my blood pressure and my pulse, and I have to do all of that at 10 o'clock. So
Right.
that's also called telehealth. So what happens is I've got my handy computer, I turn it on at 10 o'clock, and at 10 o'clock, Julie's face is looking at me.
there I am.
There she is on the computer screen, and she's like, Kathy, how you doing today?
Right.
I'm doing well. Okay. Get on the scale for me. Put the blood pressure cuff on. I want to see where you're at.
Right.
So in real time, she's able to make sure that I haven't gained too much weight, that my sodium and my fluids are balanced, that my
Right.
blood pressure is
Right.
balanced. Now, if they weren't and I needed attention, I don't know what I'm supposed to do at this point, right?
Right.
I don't know what the numbers mean and
Right.
any of that, but
Right.
she does.
Right.
So being the telehealth nurse, the nurse on the other end of this computer, she calls my cardiologist or my pulmonologist or whoever's managing this part of my care and says, Kathy's weight is up 5 pounds today and she took her medicine. What do you want us to do?
Right.
And I get direction that day.
Right. And the patient's reassured. You know, the
Yeah.
patient's reassured because she's got healthcare individuals, staff looking at her.
Right at home.
And yeah, she doesn't have to leave, and you know, she's obviously they're in touch with her doctors.
Yeah.
And that's a good feeling. And
It is. It fosters a wonderful sense of independence
Right.
and autonomy.
Right.
And let's face
builds
it.
a sense of trust for both.
Yeah.
You know, the doctors seeing that the patient is doing what they have recommended, so they're all happy, and then the patient's happy because
This keeps people out of the hospital. Like it's
Right.
huge how
right.
effective this tool is. The
Right.
telehealth tool is at keeping people out of the hospital when you're monitoring those kinds of things.
Right. So to sum it up, these are different ways that telehealth is used.
Yep.
It can be just like if you know a FaceTime on your phone, just as a review. It can be used through your doctor's office. They will give you directions.
They
Every
always
health
do.
system is doing telehealth
always
in their
do.
own way.
Yes.
And as far as, you know, when you're in your home, you're not paying for that copay right away, but you can always call your insurance company and find out what your telehealth benefits are.
I would strongly recommend that you do that because it's
It may be the same cost as a in-person visit, but again, you're feeling better because
Yeah.
you don't have to leave your home.
and often the monitoring systems are not.
Right.
They are a covered benefit.
right,
So if
through
you're
home care, you may never see a copay.
So if you're feeling like you can't get your congestive heart failure managed well, if you're feeling like you're really struggling with managing your diabetes
or blood pressure,
or blood pressure or
COPD,
the
different conditions that telehealth is used for.
obstructive pulmonary
Right.
disease, any of those things, we would
Right.
strongly encourage. You don't have to wait for the doctor to ask you if this is an option for you. You can, if you're struggling, we would encourage you to say, "Hey doc, what would telehealth be a benefit for me if I'm working on my scale weight and managing my blood pressure with my new medication changes?" I can almost promise you that they're going to say yes.
Right, and they like to see people being proactive about their health, and they're there to help, and your home care agencies are there to help, and your specialists are there. I mean, but it's navigating the system, and that's what we're trying to help. So be
Yeah.
informed,
Yeah.
save time, save money, and
Yeah,
we'll see you in our next video.
we certainly will. Have a good day.
Bye now.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.